growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, it's Dr. Steve Rasner, and you are tuned in to The Lionhearted Dentist. Dentists still want to dream. You can email me at drrasner at AOL if you have any questions. Which brings up last week. When I did last week's podcast, I was getting into marketing, and I promised you that I would elaborate on that in this podcast, which I may not get to because I came up with a great concept that I think is going to be helpful to all of us. And by the way, on marketing that I talked about, all you got to say is send me whatever information you have on marketing that's been successful for you. And I'll send you my various programs and follow up with it. I mean, you guys got to know something. When I started in 1980, there wasn't any internet. I'll tell you what I did. I'm not kidding. I would read a book that somebody wrote, and then I would look up who wrote it and find out where they were from. And then I'd write them a letter, and I would hear back from them 1 out of 10 times. But I did hear back from some of them, and I would go visit them. It's actually how my lecture career began. I visited a Texan dentist named Earl Estep because I had read one of his books. And I don't remember exactly how I found him, but I did. And he invited me to come down to Texas. It was a Monday morning. I was coming back from a Frank Spear course, of which I took every course Frank ever gave, and John Coy's, and both of them together when they were partners. And it was Seattle to Philadelphia, so it was a long flight. And I had plenty of time to read. And I would take notes on stuff I liked. And I would reach out to these authors. And he wasn't the only one. But anyway, that one wrote something real nice about me one time in his magazine after we met several months later. And I got invited to do all these lectures. That's the truth. That's how it started. And I would visit, or at least try to visit, successful practices around New Jersey that I was heard of. And, sometimes the doctor wouldn't never call me back. And once in a while they did. And I would go there, and sometimes it was worth it. And sometimes it wasn't. I mean, the point is that you have to have this thirst, that Kobe Bryant, pardon the analogy, but the Kobe Bryant desire to be great at what we do. And lots of times it ends up disappointing you. But often it doesn't. And if you aren't willing to give that, I'm not sure. I'm not sure where the road ends. But I know a lot of you because I've met a lot of you since I've been doing these podcasts. And a lot of you are on the road. You may not even know how far you are on the right road to a beautiful place. And that beautiful place is defined a lot more than just your income. It's defined by feeling good about yourself. I mean it. Feeling good about this amazing skill set that you never thought you could own. I mean, you can hear it and you can see it in my face if you're watching me. I never dreamed I would be able to do the things I'm able to do. If it was possible to rank where I fit into the world of good dentist, I'm trying to be the best version of me. And I know that's an old, tired line, but man, it's the truth. And that's what you need to be. And you can't be that by just taking online courses and convenient courses or whatever. And you can't do it once in a while. It's a lifetime commitment to investing in yourself. So Here's what we're going to talk about tonight. I started out with this podcast thinking it was just for newer dentists that acquired an office recently or about to acquire an office. And I do not really know the demographics of who's listening to these podcasts, but I can tell from a lot of the emails that many of you are on the younger side. Maybe the fact that some of you are in dental school is the giveaway. So I think this is an important subject. It could be a universal to any new patient that comes into your world. And I've never done the breakdown on how valuable it is to keep and maintain that new human being that walks into your practice. But I suspect it is invaluable, or as they say in the credit card commercials, priceless. I mean, a patient that comes to you once and never leaves you, which is a pretty damn good thing. What's the value of that? So let me tell you the best way, not all the time, it doesn't work all the time is what I mean, that I have developed, and I haven't talked about this on other podcasts. Besides the obvious, and it's not the scope of this particular podcast, about how do you prepare, about what is said to the new patient on the phone so they don't walk into a ambush and feel like, oh my God, what are you talking about? A full set of x-rays. What are you talking about? A full exam? Because, by the way, we don't even use those words. So go back to other podcasts if you want to know that information, because you have to start there. But I'm talking about the moment that I meet them. They've already had x-rays in my office. Okay? I got to tell you, I'm surprised. I even had patients come in with printed x-rays in their hand. Now, I can't diagnose off of printed x-rays, and neither can you, by the way. And so maybe they just had them done last week. I just almost never have a patient say no to me. I can't even remember when. I'll say, you know what? I really appreciate that you just had these done, but it's totally my responsibility to diagnose you accurately, and I won't even charge them for the x-rays. Are you kidding me? I could care less. To be quite honest with you, I have a whole different concept, and this could be very, very controversial, of how much I make out of hygiene, period. I mean, I certainly have pretty decent fees, but I think you need to build a family of patients. And I can assure you, when you have a multi-million-dollar practice, at least in my world of 39 years, the bulk of it's not coming from hygiene. The bulk of it's coming from doing a comprehensive exam on somebody that knows they're getting a comprehensive exam. That I've never used that term to that patient, by the way. Because if you do that with sincerity, vast majority of patients need things. But let me get back to how I would start the whole process. I mean this, and I've never said this. I would walk in, I would make sure I had every bit of 45 minutes to an hour for your participation in a new patient experience. Certainly a minimum of a half an hour. And you are not to be interrupted. Nobody can come in and tell you somebody's on the phone. You can't schedule anything really important during this time. It's you and the patient. Otherwise, it's going to come off as artificial, as something they've seen or felt something similar to before. And I would start and say this. I would say, I can only imagine how scary it is and even awkward to switch dentist, to meet me, the new dentist. And I want you to know I am very sensitive to that. So I'm going to tell you what you're going to get here. I'm going to tell you what you're going to get with me. Now, I haven't even got into why they came to you. But I would do this with any new patient that sits in my chair. And I just started doing it in my own practice. And I would say what you're going to get is a place that you consider safe and you can trust my opinions on what I'll deliver to you on how I would go about moving forward with your mouth from this day on. And that recommendation is going to depend on several things. It's going to depend on what I see when I look in your mouth. It's going to depend on what it is you want me to do. It's going to depend on how I see the whole picture for you, not just today, but in the years to come, because that's my responsibility. And I'm not going to pressure you. I'm not going to sell you anything. I consider this to be a place of great competence. You've chosen to give us a chance to welcome you into our dental family. You don't have to say that, but wouldn't be bad, by the way. And I know it takes time for this. I know it takes time. I may say things on you, multiple things that I don't love. Doesn't mean we have to do them all in a day. And the fact that I bought Dr. Smith's practice doesn't mean we have exactly the same philosophy of care. So here I am. I'm going to tell you what I believe in. This is where you're at today. Remember, they have followed the protocol of the new patient telephone call. They know I was going to look at their whole mouth. That's how we call it a full exam. I wouldn't use a full exam. I think it's intimidating. I wouldn't say comprehensive exam. I would let them know that we're going to take whatever diagnostics we need to give you an accurate response. And if they indicated a lot of need, I would ask if there's any chance they could bring, if they have a significant other, a significant other. See, you are what you set out to be. I know that'll never make a Shakespeare book. But you create the practice by the parameters that you decide are important to you. And I don't know why anybody listening to me or not listening to me would want to practice where you bring in a new patient and whatever, you treat the symptom. So they have pain on the lower right. So you treatment plan a root canal and a crown. Or you do a pulpotomy on day 1. We don't even work on them clinically day 1. 99% of the time. And I remember when I made that personal transition, how scary it seemed to me. Oh my God, we're not going to clean them the day we meet them? They're never going to stay with us. It's nonsense. Of course they're going to stay with you. So if you don't know that line, and some of you want it, the one I just went about, you can imagine how scary it is, and you want to create a safe place that they can trust. If you talk like that, I'm telling you, and you look them dead in the eye, and hopefully their significant other is in another chair in this operatory, I can't imagine how you could go wrong. I can't. And even if they don't accept your treatment plan that you come up with, I'm a firm believer that if you do know the treatment plan, day 1, that's the day you should tell them what you would do. I actually say, I could do a whole podcast on the different things that come out of my mouth depending on what's going on during this initial visit. But a lot of times, if it's appropriate, I love to say, I'm going to tell you exactly what I would do if I was you and why, if you can. Just think of that one line I just said. I'm going to tell you exactly what I would do and why I would do that, if you can. I mean, that is powerful stuff. I think it's that kind of stuff that is responsible for the incredible case acceptance that occurs in my office. How else could I possibly continue over year after year to produce the numbers that I produce? There are certain things you can't deviate from, and I got to tell you that initial visit is everything. So let me say this equally important. You need to try to be as conservative as you can. Now, that's just a sentence to you right now. But this is what I mean by that. You have to draw lines in the sand. And it's okay to do that. Because when you're telling them that not every dentist has the same philosophy, you could say, for example, I have a philosophy that no matter why you came to me, your gum health, the health of the pink tissue around your teeth is the number one factor for you keeping your teeth, and I'm a stickler on it. I say different shades of that all the time. I do. I've never taken a soft tissue maintenance course to sell people on different soft tissue packages. Never once did I do that. Look, they get scaled and root planed. I do not clean somebody a little extra heavy that's got perio-pocketing, poor tissue color, poor tissue tone, lack of stippling, pockets, so that they'll like me. I don't do that. I'm fine with not changing old amalgams that I'm sure in other offices would be crowns. Maybe they have a broken part of the amalgam off. And the patient didn't even know that, by the way. And there's clean dentin under there. And I'm sure that if I took out that whole amalgam, there would be some possible spots of early recurrent decay. That wouldn't shock me. But you should know by now, and you do, that decay does not progress linearly. It doesn't double in size every year. Decay, depending on the patient's chemical environment in their mouth, their diet, everything else, can be dormant for even years. So I'm okay with not having to restore every tooth in their mouth. So I would go in particularly with a patient and a new practice you've bought with this kind of attitude. And it does not make you a bad dentist. You can still do a comprehensive exam. Whenever you can segment treatment, you should segment treatment. You may end up doing 2 fillings and 1 crown in a quadrant and also do quad scales on that patient. And every time I do quad scales, you got to know something's going to happen to you 10, 20, 30, 40 years from now as you get older. You're going to get incredibly clear. Or maybe that's just what a curmudgeon, I can't say the word, Beth. Maybe that's what an older person that's grumpy becomes. I don't think so. I just want to be as clear as I possibly can. So when I tell them that they're going to need scale and root plane, I also will tell them that also means you're going to make a commitment to come in here every 4 months, and insurance doesn't even pay you back for that extra 3rd time that year. And it's going to come around so quick you'll think you don't need it. But if you're going to invest in getting your gum health at least the first year, and in many cases, indefinitely, if that's the kind of mouth you want, because that's what I try to build. And guess what, colleagues? Your restos look greater in pink stippled gingiva 5, 10, 15 years from now. They do. So you do have to draw some lines in the sand. You can't segment periodontal scaling and root planing. And by the way, if it's a pocket degree or advanced care that you're pretty clear that scaling and root planing is not going to address that, don't block off. I don't have a practice that does not include oral surgeons. Even though I have an amazing array outside the general GP scope of services. Do what you want to do. But the podcast you're listening to, I try to enlist a periodontist if I think it's going to take more than scaling and root planing. Then maybe they have +7 pockets and they really want to keep their teeth. Maybe the local periodontist in your area, maybe he's got LANAP therapy. And he's got a good resume with LANAP therapy. I send to my oral surgeon. I do. I send third molars, all third molars. You don't think I can do a third molar? I do ramus grafts. I do sinus lifts. I can do a third molar. But they can do it faster. And also, any patient that remotely, I believe, should be in an environment that's more conducive to emergent medicine that might be needed in the care of that patient. Don't, being a super dentist, a super GP, should not exclude your specialist. Now, you may have specialists, I mean this, in your community, that if you don't send them everything, that they have an attitude. I would work on it. And if it doesn't work, it doesn't work. Then you'll have to find a specialist. And some of you are in rural areas that the next specialist is an hour and a half away. Not many of you are in that situation. But I've lectured all over this country. And particularly in Nebraska, I met a lot of dentists where the next dentist, the next oral surgeon, periodontist, could be over an hour drive. Then you need to take a lot of CE in the arenas that we're talking about. The takeaway from today is creating a verbal exchange. It doesn't even have to be long. If you really think about what I just said, we're talking about a 5 to 10 minute conversation where you're just totally sincere and that your goal for this patient is to keep their teeth the rest of their life. This is what you're telling a new patient. And maybe they can't do it all right now. And your job is to advise kind of what they can put off and not put off. Your job also is to step back and consider the whole picture of what's happening at that new patient visit. And what I mean by that is to get to that moment that I just keep alluding to. Obviously, from the beginning, you have to train in CE. What other information will you draw upon to make these decisions to help these patients? And you have to have a team right from the beginning. And that's the best time to change your team if you're going to end up changing them. And what do you have to lose if somebody's been with you for 4 months or 1 year or 2 years? Try losing them at 10 years or breaking free because they become clock-in type of employees. They just clock in and go through the motions. But in the beginning, it's exciting. You should be looking for that amazing team. I do find that exciting, thinking back about it now. I mean, my team members have been with me forever at this point, but not in the beginning. And then creating this thing that when that patient, that new patient leaves you, and by the way, make sure they know that you take referrals. Like if you think you hit it out of the park, say, by the way, you probably know this, but in case you don't, we love referrals. I mean, I plan on being in this community a long, long time. And if you think you have friends that would like, and how cool is it for a patient to leave your office and find, particularly, see the advantage you have over me is it's obvious I'm not young. And a lot of them look at me and wonder, well, are you going to be around? I mean, I don't think they mean, am I going to die? At least I hope not. I mean, but to find a young, passionate, put together young dentist is an exciting thing. And you know, I'm going to leave you with this. If you're listening to this podcast and hopefully you're subscribing to the philosophy of you remaining as an independent dentist in a solo practice, in a fee-for-service practice eventually. Well, the best thing you have going for you is that when I started, everybody was that. But not today. Don't tell me that the new patient that just went in through this kind of experience, and the experience includes a team and an outstanding team member that gets your philosophy and understands the protocols that you put in place. And we have to spend time on that one time. Protocols are how you do things. I wrote a book called The Protocol Book. I wrote that because It defined what I need everybody to do regarding different procedures, opening the office, seating a new patient, checking out a new patient, checking out any patient, meaning taking a payment, scheduling a new appointment, all these things, handling phone calls on they lost their temporary. I mean, if you don't have protocols in place, then everything's a new event, right? That's what happened to me after 15, 20 years. I decided I didn't want that anymore. Because what used to happen is I'd have good weeks and bad weeks. Sometimes it'd be a great week at the front desk and everybody just got it right. But at the same week, we'd be in the back not having a crown that didn't go in because we didn't see in the script that it had a reduction coping or the case wasn't even there. And there were the other weeks where we would be great in the back, but the front dropped the ball and didn't handle it effortlessly. It is a cool thing, man. It's just like a performance of a singer when it's all happening, and it doesn't happen all the time. It happens most of the time. For sure it does. And so you can't beat yourself up too much on the days, shouldn't be weeks, where people drop the ball, because people will always drop the ball. But you need to think of a patient catching you on most of your days when the symphony's going on, and they leave, even if they didn't do a big treatment plan, even if they didn't do any treatment plan, but they came away with a positive vibe that, man, this office is different. I can feel it. I can see it. And they're going to tell a lot of people. I hope this podcast helps some of you get inspired today. I hope I get a chance to meet you. Go online and see where I'm speaking, or check out one of my own courses that I give right in my own office, and just reach out to me. Let's make this happen. Good talking to you. Have a great week, and I'll see you next week on The Lionhearted.